Yeah, I just wanted to backtrack a little, Undy. I was curious about since you went to John Hopkins, you worked there for a little bit. Did you take the NCLEX while you were here in Maryland?
Yeah, I took it in Saipan.
Oh, wow. So I guess
Yeah,
I'm curious since you took both tests, the assessment in Australia and the 3 month assessment in Australia, and then the one test in the US or
yeah,
Saipan. Like, which do you think was harder? But also, do you think a test was more fair in assessing your skill set as a nurse?
yeah. I think the one because you know what, um, um, when I took up the NCLEX, it's there are more chances of you passing because it's multiple choice. So we were, you know how when we took the NCLEX, they would say never leave any questions unanswered because the chances of you getting it right is high. So unlike in Australia, when I did my assessment, you have no room to do mistakes because the exam was more on essay. And if you really don't know what you're talking about, there's no words that you can put into the paper. And with the practical assessment, it's instantly the assessor can see if you are really telling the truth or not, if you are really knowledgeable on your profession. Unlike in when you do the NCLEX, it's more on papers only. So I think the Australia assessment is harder than the one the NCLEX I did. It's tough. I think it's tougher the one here I had in Australia. Mm.
Yeah, that makes sense. It sounds like you couldn't even practice as a nurse yet until you finish the 3 month sort of like probation period.
Yeah, yeah, yeah. And the thing is, it could have been easier for you if you are a supernumerary, meaning to say you're being mentored by someone. But it wasn't like that. It was like, you have to pretend you are already working there and you are working as an RN4 or an RN5. So there is a class here, RN1 to RN8 is RN8 is the highest. After that one, in terms of actually the salary, that's why we need to each level you go to, your salary increases, and it's a state award. So whether you go to different hospitals, that doesn't change. They based you on your qualifications, not the years of your experience in that hospital. So if I work in Westmead Hospital for 4 years and I'm earning like $45 per hour, if I go to a small hospital, which is I'm only 1 year experience there for that moment, I still get the $45. They call it a state award. No one can mess up with that one. You have an equal, because that's what you earn.
I have a question. When the assessor recommended that you be an RN1, but then you went ahead to go to human resources to try to get a job in the ICU, what position was that? Was that an RN2, 3, 4?
No, that's beside that's because it's like this. In when you take your nursing, maybe you want to go to Australia. It's good. It's nice.
Maybe I'll be maybe.
Are you a nurse?
Yeah, I'm a nurse too.
Okay. This is how I'm going to give you a tip. Okay. When you go to Australia, if let's say you are an RN4, meaning to say you're 4 years experience. No. Now, let's do this like let's go to the basic. Okay. When you go and study nursing, The nursing here is only 2 years. No, 3 years, because I didn't study nursing here. So I think it's 3 years. So 3 years nursing study. After you finish your study, you are considered an RN1. So to land a job, sorry, that was my boss. To land a job, sorry. Okay. To land a job, you need to all who are newly graduate has to go through a level. So you are an RN1. When you do an RN1, you have to apply because the government put you in a certain group as an RN1 to have a training, which you are in supernumerary for 3 months, depending on what unit you are. So anyway, if you're an RN, those are the requirements. You need to be, when you finish your nursing, you really need to be an RN1. You really need to apply for as a new grad position. They call it a new grad position. Why? Because they want, this is very nice. They want you to put on a new grad position because you just finished your nursing, number one. Number two, so that they will not put pressure on you, not too much expectation, and you are being supported by a senior. So it's really nice, isn't it? They just don't throw you out of the, on the field without any weapon or anything if you are in a war. But anyway, so that is an RN1. You apply for a new grad position. But if you come here like me, I came to Australia as more than 8 years experience. You have to go to this assessment, the 3 months assessment. Now, after that one, some would say for you not to have a shock or for you to easy transition, some would ask you to do the new grad position first, which is the RN1, because you are being supported, you've been supernumerary, you have all these studies. The studies here are free. They send you to study for free. Would you imagine that? Because professional growth is very important here. So they send you all these things. They give you the support you need. Then as you go, and then you go and progress for which level you are going to. In my case, because I am an 8-year experience, I have to assert myself. I had to go and prove to them that no, I don't want to go back to basic. And because you have to be paid for your qualifications, isn't it? I mean, it's fair you be paid according to your qualifications. So I don't want to be an RN1. So
Auntie, a lot of people then, I guess, a lot of people like in your position are kind of encouraged to be an RN1. And then if with a lot of years experience though, they'd be paid a lot less. Is that correct?
Yeah. Yeah. That's why, as I mentioned a while ago, as you add years, your salary increases. And that increase will stop when you reach the 8 years. Not literally stop. I mean the counting of the level, but the salary here, it always increased because we have a very strong union. The union always, almost every 2 years or every year, every year, we just had our increase of salary here in Australia. So yeah. So when you start as a new grad, as an RN1, you are being paid differently from an RN8. I think the RN1, yeah, the new grad or the RN1 at the moment, I think it's $32 per hour.
That's interesting. You think they would just have someone mentor you and you already have a lot of years experience, instead of, forcing you to go back at stage one and kind of work all the way back up again. So it seems kind of unfair a little bit.
Yeah, that's why you have to go in, because they also want to make sure that you well, because they don't have a basis as to how competent and efficient I am. So that was the suggestion of the teacher, but I was able to prove to them that I can be a safe and competent nurse. That's the time you go and show to them how efficient you are.